ever feel confused or overwhelmed by some medical terms or information, then you are at the right place, where we assure you of simple and reliable guidance on matters your health or anything that affects your health. My name is Duke Otieno, so relax and let's talk health in a language that we can all understand. Yeah, so we just go straight to today's topic, and maybe just to ask an honest question that you can answer on the comment section, just to know, have you ever had a headache or stomach pain, cough or fever, and maybe you thought, let me just take something. I know this medicine, I know this Panadol, I know this cough syrup, I know this medicine for the stomach. Have you ever gotten yourself in that situation? People who have been able to get themselves in a situation where they were not feeling okay, and they thought they should just use a medicine. Probably they know, they have used it before, or maybe their friend or relative used it before and it really helped them. So today's topic, we're talking about self-medication. Maybe just an outline of today's conversation. So we are going to talk about self-medication. We are going to ask ourselves, why do people do this, and when does self-medication become dangerous, and how are we able to do better as a community, as a people. Yeah, so please note that this video is not about blaming anyone, but instead it's more of trying to understand how we generally get to that point of self-medication. So straight to trying to understand what self-medication is. So it is when someone uses any medicine without professional medical advice to treat symptoms like symptoms or illnesses generally. So this includes things like using an old prescription. You have a prescription that was prescribed 6 months ago by your doctor. Then because you feel the same issue that you had 6 months ago, you think it's better to reuse that prescription, or maybe taking medicine recommended by a friend or a family member. I know this is very common. You come tell me what your issue is, and I tell you I used a certain medicine and it really helped me, and I think it will help you as well. So you end up using that medicine from the recommendation by either your friend or maybe relative. We also have that aspect of buying drugs over the counter and guessing the dose. This is very common right now in our society. You just walk into the pharmacy, ask for a certain medication, then you go and take it. So it's like you are your own doctor. So that is also a form of self-medication. We also have using leftover antibiotics. It's very common for people during their antibiotic use. You know, they were prescribed with a 5-day antibiotic, but by the 3rd day, this person was feeling good, so stops the antibiotic. Then 6 months later, 3 months later, you having the same condition, then you go back to the antibiotics that you had already started taking 6 months ago. Then you are using whatever was left. So not really taking it as it's supposed to be taken, but just trying to finish the dose that you had started taking like 3 months ago. So we also have that aspect of increasing or reducing your doses of the medicine, because maybe you feel you're not getting relief as promptly as you wanted, so you think about increasing the dosage. We also have the aspect of mixing medicine without guidance, and we have one very big problem, especially in this age and era, and that is people going into the internet, doing the searches, googling their conditions and their drug, and then they just go and buy the drug. So all these are forms of self-medication, all the way from using the old prescription to the internet searches about different medical conditions, and their drugs. So in simple terms, we have these common phrases. I felt something. I chose a drug and I treated myself. So why do people self-medicate? We really need to understand what makes people to get to that point of self-medication. So let's be real, people don't self-medicate because they are reckless or maybe they are careless. No, they do it because of real life lessons. So some reasons include things like long hospital waiting time. You go to the hospital, you're taking there 6 hours, 7 hours. We also have that aspect of cost of seeing a doctor. The consultation fees sometimes are beyond what people can afford. So they thought they would rather just go to the pharmacy, get the medicine and take it. Then we also have that aspect of previous experience with the same symptoms, and also the ease to access medicine, because right now you can just walk into the pharmacy nearby and then you buy whatever drugs you want. We also have that reason where advice from friends and family, or maybe the internet. This is one of the main reasons that pushes people to self-medicate, especially the internet aspect of it. Too much believe in what the internet is saying without really doing the background, the causes, and knowing the right doses. And then we also have that phrase of this drug worked for me last time, so let me go for it. And some people don't want to hear bad news. Some people associate the hospital with bad news. Maybe you'll go to the hospital and then you'll be diagnosed with something that really your mind is not ready for. So it's more of living in denial. So you just think about going to the pharmacy, buying a drug, and that's all, without doing that root cause analysis. So I don't want to hear the bad news kind of statement that pushes people to self-medicate. So it's important to understand that here's the problem. The symptoms can look the same, but the causes can be very, very different. And during treatment, most of the time you're just trying to focus on the root cause. So because the symptoms are the same and you're using the past treatment, but the cause has changed, then we end up not getting the desired effect from the self-medication practice that we undertake on. So what are some of the most commonly self-medicated drugs? Just from the usual suspects, people commonly self-medicate with painkillers, especially the Brufen. Right now, I think it's trending. People making fun of the Brufen, saying how it treats everything and so forth. Things like paracetamol, commonly known by many, Panadol, and also diclofenac. We also have antibiotics. Someone is having a flu, someone is going for an antibiotic for a flu. You have antimalarials because you're just feeling that chill, you're feeling, those symptoms of malaria. You just go direct for the antimalarials, the cough syrups, the acid reducing drugs. I think almost most people have at one time of their lives used some of these acid reducing drugs, saying they are feeling gas. Some call it ulcers, so they just rush to the pharmacy, buy some of these anti-acid reducing drugs, and then use. Then you also have the allergy medicine, the sleeping pills, and the herbal or the traditional medicine. These days we have quite a number of these herbal-based drugs. So people have that in mind, that herbal drugs are safe. So they feel it's okay to just self-medicate on them. So it is one of the most self-medicated drugs so far in the market. But some of these are safe when used correctly. Here we need to underline the word when used correctly. But since you don't know about the safety profile of some of this medicine, the danger comes when the wrong drug is used, or when the wrong dosage is taken, or the wrong duration is followed, or the wrong person takes it. because not all drugs can be taken by all persons. Yeah. So, what are some of the hidden dangers around self-medication? Let's just go to the truth. Wrong diagnosis. A headache could be due to stress, could be due to high blood pressure, infection, maybe eye issues or dehydration. Therefore, taking a painkiller may hide some of these symptoms but not really treat the cause to your headache. We also have the aspect of drug interaction, whereby mixing medicine without knowing how dangerous that can be. For example, someone is taking a painkiller together with a blood pressure medicine, maybe a herbal remedy plus some other prescribed, the conventional kind of medicine, or maybe alcohol and a cough syrup. Some of these combinations are quietly damaging our internal organs over time. So it is a very important thing to note that we have that thing that we call drug interaction. Then we also have the danger of overdose and organ damage, where you find someone is taking very high dosage of paracetamol, since it's just a common drug as they refer to it, which of course will lead to liver damage. Someone taking too many painkillers, thinking that when you take too many painkillers you'll get a very good effect, very prompt relief of the pain, but you end up damaging your kidneys. And some people who are using some of these painkillers for a long duration of time, since they're just masking the symptoms but not really treating the cause, they end up having things like stomach ulcers, because some of these painkillers usually irritate the stomach lining. And what's the scary part? The damage usually happens silently. Yes. Then we also have the aspect of antibiotic resistance. Of course, this is a very big issue globally right now. People are using antibiotics when they really don't need them. Some even don't finish the doses, and you don't know the duration for a specific condition. So when you just self-medicate, you'll be taking an antibiotic but not for the duration that you're supposed to take. Some people you share with others since it helped you. So because I used a certain antibiotic and it helped me, so I'm recommending it to you, but really you don't need it. So we end up having that aspect of antibiotic resistance. And when I talk about antibiotic resistance, maybe let me just try to explain it. This is when a bacteria stops responding to treatment. That means infection has become harder and more expensive, and sometimes even impossible to treat, because when you get to be resistant to the conventional, like the baseline kind of antibiotics, that means for any antibiotic treatment you have to be put on a more stronger one, which of course has that aspect of cost that most people probably might not be able to afford. So what are some of the specific groups of people that really need to be cautious and not to self-medicate? Of course, everyone, but then we have this specific group of people, children. In children, there is that aspect of dosing errors, which is very common. We need to know that children are not small adults. There's this common practice of, if an adult takes one tablet, when it's a child, give that child half. Please note that children are not half adults. They are not small adults. Yes. We also have pregnant women. Some medicine can harm the baby. We also have the elderly people who, in most cases will find they're taking multiple drugs. So there is that aspect of drug-to-drug interaction risk, and also their organ has started tiring up. So they might not have that endurance to metabolize some of these drugs and maybe to excrete them. Then we also have people who are living with long-term illnesses, conditions like diabetes, high blood pressure, heart diseases, which makes self-medication riskier, because some of these drugs might worsen the effect of the other one. So not really advisable for people who are on some of this chronic medication to self-medicate. But then we have this aspect of, but it worked last time for me. Yes, this is a very common argument by people, and of course it sounds logical. If it worked last time, of course even today, this time it will work. But remember, your body changes, the disease also evolves, and symptoms repeat, but causes don't always repeat. So when is self-medication acceptable? We also have those situations when we say the self-medication can be acceptable. So it's important to know that self-medication is not completely a sin or a criminal act. Not all self-medication is bad. Some responsible self-medication, self-care includes things like using approved over-the-counter drugs. We have the over-the-counter drugs and we have prescription drugs. So using approved over-the-counter drugs, that can be acceptable. We also have the aspect of following the correct doses, treating some of these minor and short-term symptoms, reading labels carefully. In each and every medicine, we usually have that label inside, so you can just take your time, try and read, understand the drug, before you use the drug. Then seeking help if symptoms persist. So the main word here is short-term, correct dose, and clear limits. The moment symptoms persist or worsens or repeat, it's time to seek for professional advice. So how safe is it to medicate safely if you must? There is a way you can safely self-medicate, and the golden rule to self-medication is never use antibiotics without prescription, never share medicine, never mix drugs unless advised by your healthcare provider. Don't increase your doses thinking that you'll get better effect of the drug, and don't reuse old prescriptions. You also need to always have that culture of reading the labels carefully. You also need to have that culture of asking your pharmacist or healthcare professional when unsure of anything about your drugs or maybe your illness that you're having. And self-care should never replace proper medical care. Self-medication generally is not just a personal issue, but it's more of a public health issue, since it affects drug effectiveness, healthcare cost, treatment outcomes, and things like community safety. So being informed really doesn't mean treating yourself, but it simply means knowing when not to treat yourself. And to wrap this up, just to let you know that self-medication may feel convenient, it may seem affordable and familiar, but it comes with real risk when done incorrectly. Medicine are a very powerful tool, and just like any other powerful tool, they must be used wisely. And please know that when in doubt, ask, don't guess. This has been the Inside Health. Thank you for watching, and if you found this video helpful, please like the video, leave a comment, and subscribe to the channel to help us reach more and more people with simple health information. I've been your host, Dio Cotieno. See you in the next one.